Hello everybody, I'm Jana from Sydney Visa. Given the world pandemic and the global awareness of the importance of the medical staff, today's video is about the immigration for doctors. More specifically, we're going to talk about the process of acquiring a skill assessment which is necessary for the successful migration under the skill migration program. There are more than 35 occupations on the Australian occupations list that are to do with health professionals, and there is a shortage of medical professionals in regional Australia. Nonetheless, the path of becoming a medical doctor, especially from overseas in Australia, is difficult and demanding, both financially and emotionally. In this video, I will outline the process of obtaining this skill assessment. We're going to be talking about the tests that you will need to take, the costs, and a few other things. To acquire the Australian skilled visa, all occupations on the occupation list must undergo skill assessment. For doctors, the process involves obtaining a registration from MedBA, so it's a Medical Board of Australia. A doctor can only migrate to Australia by obtaining full registration from the MedBA. The overseas professionals, they have several ways of becoming registered. First of all of the doctors must have good English at a level of equivalent of IELTS Academic All Sevens. But by the way, many doctors prefer to take occupational English test for healthcare professionals rather than IELTS. The test is very similar to IELTS, but since the test contains a lot of medical terminology, some doctors find it a little bit easier and more familiar. There are three pathways for medical qualification. So there is a competent authority pathway, which is for doctors from the countries accredited by either General Medical Council, Medical Council of Canada, Educational Commission for Foreign Medical Graduates of the United States, Medical Council of New Zealand, and Medical Council of Ireland. So basically, if you have gained your doctor qualification in UK, Canada, New Zealand, USA or Ireland, you will undergo a simple accreditation pathway and will not need to take the test, which I'm going to talk about. Then there is a standard pathway. So this pathway is for general practitioners who graduated from foreign universities that are not included in the competent authority pathway I mentioned above. And also there is a third one, is a specialist pathway, and this pathway is for specialists in the different and quite specific fields of medicine. Let's first take a look at the standard pathway. So this is what this pathway looks like. And let's break it down step by step. So the first one, this is essentially an audit of your educational institution for compliance with the Australian Global Medical Standard. Fortunately, there is quite a lengthy list of approved institutions from around the world. There are two lists actually. There is an Australian list, so the Australian Medical Council, and the world list. Your university must be in both lists to successfully pass this stage of accreditation. I will leave the links to both lists in the description, so you can check for your education provider if you are on the list and if you're eligible. Second part is this. So you need to take this multiple choice exam. So it's a test. This is conducted at examination centers around the world. It takes about 3.5 hours and consists of 150 questions, and they cover all areas of medicine. The questions have varying degree of difficulty, and different marks are given to different questions. By the way, you can test yourself and take a practice test completely free of charge. Again, I will leave the link to that test for you in the description to this video. So once you have passed, and if you have passed the multiple choice question test, you can move on to the next step. And the next step is the Australian Medical Council clinical exam. So the test itself, it's a practical test, and it looks something like this. So you are given 20 stations. At each station, a medical case scenario from various fields of medicine is played out to you, and you are assessed at the 14 out of 20 stations. You need to make a diagnosis and prescribe a treatment. You have about 8 minutes for each station plus 2-minute reading time. You will be assessed both on the accuracy of your findings as well as your ability to build rapport with the patient. This test is conducted in Australia only, so you will need to travel to Australia to take this test. You will receive the result from the practical examination test in about 10 days, so it's quite quick. And a positive result in both examination entitles you to seek employment as an intern. So that's your next stage. And no matter how long you have practiced medicine in your home country, passing all the Australian exam puts you into this graduate level in Australia, where you need to find a hospital where you can undertake your internship. So that internship lasts for 12 months. So, and you have to look for this hospital yourself. Upon the receipt of the job offer from the hospital, you receive a provisional registration from the Medical Board of Australia, which entitles you to work under the supervision of other doctors. After 12 months, as I said, as an intern, you can obtain your general registration with MedBA. There is another route available instead of the clinical test, so we can see here, but assessing your skills in the work environment. So this pathway is within a testing phase, and it has been for a while, and is currently offered only by a few hospitals. It is extremely difficult to get into this program, so I'm not going to waste the time going about it just yet. Let's take a look at the competent authority pathway. Essentially, this process consists of these steps, so you're skipping the testing in between, so you're not doing all this multiple choice and the clinical test. If, as I mentioned, you have been accredited by the General Medical Council of Canada, United States, New Zealand, Ireland, and so forth. I mentioned them earlier. There is different criteria for these countries and authorities, which is divided into categories, so as you can see here. So you will need to satisfy this criteria in order to proceed via this pathway. So the next question is when you get your skill assessment, the availability of which entitles you to apply for the skill visas 189, 491 or 190. The answer is after you have received your registrations with MedBA. So, and that basically means that only after you have completed your 12 months internship. If you go through the entire process while residing overseas, then you will need to get various visas to take your exam and do your internship. So for your practical examination, for example, a tourist visa might work, but for your internship, a training visa 407 might be suitable. This potentially means that you can start your relocation process once you secured the internship with the hospital. Your family members can be included on your 407 visa, but you need to be mindful that 407 visa doesn't provide for medical cover and allows your family members to work no more than 20 hours per week. Let's go quickly through the cost of the standard pathway process. So the registration with the Australian Medical Council costs $500. The multiple choice exam costs $2,720. Plus you need to be mindful of the cost of traveling to the examination centers if they're not in your country. The clinical exam, the practical exam, the cost is $3,530. Again, it takes place in Melbourne in Australia, so you need to factor in the cost associated with getting there, living, and visa application. Then the cost of the 407 visa application is $315 for the main applicant. If you wish to use the services of an agent, for example, Sydney Visa, then there is an additional fee. With us, the doctor skill assessment fee includes the application for the required tourist and the training visas, and it is payable over time in stages as you progress through your assessment. So the total cost is about 10 to 15,000 Australian dollars for doctor skill assessment. Sounds expensive, but an average general practitioner salary in Australia is $200,000 to $300,000 a year, and even as much as $400,000 including overtime. Incidentally, even an intern, when you work in a hospital, interns average about $66,000 a year as well. This is it for now. Please do not forget to like the video and share it with your friends and subscribe to our channel. If you have any questions, I invite you to ask them here in the comment section below, or you can email us on mail@sydneyvisa.com.au. Cheers from Down Under. Goodbye.